Welcome, everyone. Welcome, welcome. First, I want to thank my good friend Jeremy Harris, as every week for playing. Everyone give Jeremy some love. Also, is Sal Pizarro here? Apparently not. Just want to thank Sal for filling in last week. I'm sure he did. And I guess the mutiny was not successful, so I'm back. I want to welcome Rotarians and guests. This is our meeting number 5319 of our club. It's a lot of meetings, 5,319, and Bert George has been to all of them except one. Right, Bertie? Guests and members with guests, please come up to the microphone. Bring your guest with you so we can all see the guest. Looks like we're going to start with Fernando.
Thank you very much. And before we start, let me give you some past presidents' advice. The bell that we have is used throughout the Rotary world. When you sound the bell, that's the beginning of the meeting. And when you end the meeting, that's the end of the meeting. There you go.
Thank you, Fernando. I forgot. I'm still new at this.
Well, I have as my guest, first of all, Pete Settlemeyer. He is the new CEO of Downtown College Prep, that formerly, for those of us around here, knew as the former Southern Lumber Building, which was changed over, and now he's heading that. He's got, what, 1,700 students? Most of them, or all of them, are first-generation students, all preparing to go to a four-year college. So Pete Settlemeyer, he's from Whittier by way of Atlanta and back to San Jose.
Welcome, Pete.
I also have with me the Director of Advancement, Katie Hegarty Sasweta. That name may sound a bell. Dave Hegarty was her uncle, and so she has some really strong Rotary creds here. So she's the Director of Advancement, Katie Hegarty. She's happens to be my daughter-in-law.
Welcome, Katie.
She went to Notre Dame.
Welcome.
And with me is my daughter, Antonia, Antonia Charles. She is a graduate from Lincoln High School and went to Stanford, went to UC Medical School, UCSF. So Antonia Maitland, she came with her scrubs. I said, that's fine. We're all used to our working duds. So
welcome, Antonia.
Thank you.
Thank you, Fernando. Any other guests today? Is that possible? Well, I know we have one more guest. Oh, no, here we go.
Hi, President Steve, Catherine Cook.
Hi, Catherine.
I'm here to introduce Noel Kalunda. He's visiting here from Uganda. He's been doing marathons in the States, but is also representing his nonprofit, Schools Not Streets.
Noel, I'm sorry, go ahead.
No, and he's here to present a flag to our club.
Come on up, Noel.
Thank you, President. My name is Noel Thomas. I come from Uganda. My Rotary Club is Rotary Club of Ruvowa in Kampala, Uganda, District 914. I founded a nonprofit, Schools Not Streets Global, and I also founded a school in Uganda called Luther Christian Academy, which provides education to formerly street-connected children. I'm visiting the States, and I'll be out on the 28th. Thank you very much.
I really love having visitors from the rest of the world, Noel. It's really, really good to have you. Thank you. Thanks to the greeting line today, Los Amigos de Washington School. That was very nice. And sad announcement of a former member of ours, Paul Mascalier. Many of us old timers knew Paul very well. He died a few weeks ago. He wasn't a member at the time. He had left and was a member, I think, in maybe Fresno. Thank you, Fresno. But Paul was really one of the good people. So let's have a brief moment of silence for Paul. Thank you. There may be a eulogy for him later from his son. Also notice there are little cards on the tables for Red Badge members. We're trying to integrate Red Badgers into the group. I don't know how many Red Badgers are here today. Stand up if you're a Red Badger. 1, 2, 3, 4. Great. And really the point, everyone, of the Red Badgers is if they're at your table, please welcome them, make them feel like one of us, and do whatever you can to help them. Also, our own Barry Christina, his brother Rich, and their family are being honored as distinguished citizens by the Boy Scouts. That'll be on November 18th at the Hayes Mansion. Is Barry here today? I think not. Again, one of the wonderful members of our club. So please support them. Go support Barry, support our Jason Stein and John Ball and all the people who do all the good work for the Boy Scouts. Thank you. Linda Ellis and Heather Lerner are going to come up and give us an update about membership committee progress. Come on up.
Hi, Linda. How's it going?
Good, how are you?
Excellent, excellent. We're here to talk about membership and membership committee. There might even be a slide up there. I know, right? I figured there'd be like this huge, big room full of us just to celebrate membership. It's going really well. Right. I think we have a slide. Do we? I think we have a slide. Well, what we want to say is thank you to those who've been recruiting members in the membership committee. It's a lot of fun. It's a big full room of folks, and we've been receiving a lot of new applications, lots of new exciting faces that represent a lot of different areas that I haven't seen before, so I'm really thrilled about that. But the one thing that I do see in common every time is these are people that love our four-way test, and they value service above self. They're also seen as leaders in the community. And what that might mean is that we know who CEOs are, C-suite, all that kind of thing, but also think about people who are leaders in the community. They don't even see themselves as leaders, but their peers certainly do. And I've been seeing a trend along that, and I'm really happy to see that.
Yeah, we just want you to keep in mind to think a little bit out of the box when you're out there meeting people. Just think about what downtown San Jose looks like, and you know, you're looking at your restaurateurs, your educators, your leaders, your placemakers, your arts leaders. So just think about how you want to, well, how downtown San Jose looks. We want that for our club as well, and so just think a little bit outside of the box and grab onto those people, because we want to give them the gift of Rotary. We all know how much Rotary has impacted our lives, and we want to bring these people into our community and have them and their talents help us be a better club. Okay?
Awesome. Thank you. Thank you. So we're going to ask you for your help now. I'm sure you have your wristbands. I know I got mine. I've got my new friend, not my new friend, my new Red Badger, but old friend Trisha here. Trisha, just give me a wave over there. I got a wristband because of you, so that's really cool. So anyway, you're going to want to get your wristband. Of course, Steve's got a great membership goal for the year, and we are well on our way. I'm going to ask you to not just look left and right at what you usually think are Rotarians, but go a few clicks over. And what I just said earlier about who are leaders that might not even see themselves as leaders, who are representing that Rotary spirit wherever they go, wherever they do, let's make sure that they feel invited and welcome to participate here. We've got so many fantastic committees that need their talents and perspectives to make our city continuing to be such a wonderful place. So may I have your help with that? Excellent. Thank you. We look forward to seeing a robust application process at our next Rotary meeting led by Matt Bell. All right. Thanks, folks.
Thank you, Linda and Heather. Next up, we have Sarah Klisch and Clarence Stones. Come on up. Sarah, I'll try to help you so Clarence doesn't screw up too much. Okay.
Thank you. This is a presentation from the Rotary Foundation, your beloved foundation. And I just want you all to know the easiest job in Rotary is being the foundation president or the club president. I mean, Steve and I, we have no idea what's going on. We get handed a talking point list in the morning. Teresa and Leslie and Marie do all the hard work, and we're sort of like the chatty Cathy of Rotary. You just pull the cord and we and then we're all done. So there you have it. All right, so having said that, sorry, Sarah. Go ahead, Sarah. Step up and do the presentation.
All right, so today we are here to recognize those individuals in our club who have continued cumulatively to give money to the foundation, and they have recognized a new level of recognition, okay? So first and foremost, I want to say there are many, many people in this club who are already part of this prestigious group of people to which these folks that we're going to recognize today are joining. So we are not in any way diminishing any of you who have already received this recognition. We're just celebrating those who are joining you today. So I'm going to read off these names, and for those of you who are here, you know the drill. You come up, you shake Mr. Clarence and Steve's hands, or elbow bump, or whatever you're comfortable with, and get your pin. So here we go. Michelle Acosta, Mary Beth Affleck-Nacy, Terry Austin, Terry Chapman, Catherine Cook, Mary Curtis, Robin Doran, Audrey Fox, Patrick Frowley, Bill Highlander, Linda Kane Neufeld, Nicole Mikuleski, Nick Nichols, Dan Orloff, Brenda Sweeney, Lawrence Terry, Fred Wilhelm, Maggie Wilhelm, and James Williams. Would you please give all of these folks a round of applause? So far, it's working wonderfully. So nice. They're following instructions. I love it. All right. So the next level of, just to clear, those are endowments. So that's the first level of recognition. When you hit $2,500 cumulatively contributing to the foundation, you get your first pin. So these folks have reached the level of Ruby. So now they're at 10,000. So here we go. Those folks include Fred Begun, Steve Borkenhagen, who's that? Daniel Bizzuto, Thomas Hastings, Sandra Jewett, Alfred Moore, Jim Nielsen, Steve Prouty, Irvie Smith, and Art Williams. So please give all of those folks also a round of applause. Okay. Next level. Stop slides. Diamond Fellows. So you can see it, but I'll say it out loud. $25,000 or more cumulatively up to $499,999. So those folks include the Abbott Klein family, Dave Davis, Jerry Greer, David Neal, and Dave Peterson. So again, congratulations to all of those folks, and thank you. So the next level of recognition is Silver Patron, $50,000 to just under $100,000 cumulative gift to the foundation. And today, Sue Smith could not join us, but we are going to give her a round of applause because she earns it. And then last but not least today, Gold Patron, $100,000 up to $249,999, and that today is Howard Loomis, who again could not be here, but please give him a round of applause. So once a year, we're going to continue this process where we recognize those who have attained new levels. We always have available any and all records for those of you who wonder where you stand. So if you're thinking, hey, what's it going to take for me to get to the next level? Reach out to me and I can tell you. Thank you very much.
Thank you all very much from the foundation board. And I just want to say, all funniness aside, Sarah and her team did a humongous, gargantuan effort to pull all this data together and continue to do it. Thank you. Thank everybody that worked so hard in Rotary. I love you all.
Thank you all for those generous gifts. It's really beautiful. Kathy Wiley, you here? Come on up, Kathy. I've got you for a couple minutes to talk about Los Amigos upcoming events.
So on Monday, 6 or 7 of us met at the Gordon House out on the patio, and we packed 400 bags of trick-or-treat goodies for the students at Washington School, because again, they did not feel that they could actually have their Halloween parade and their Halloween activities that they normally have at the school. So they asked us once again to pack these bags. And I must say, the ladies were super fast, because normally it takes us a couple of days. We did it all in one day. So we have 400 bags of chocolates, etc., stashed in Leslie's office until the end of the last week of October. On October 29th, we're going to do the distribution at 2 o'clock. It will be filmed. If you want to come and help give out trick-or-treat bags to the kids, we're asking them to come in their costumes. You're welcome to come over and take a look. And also the police ice cream wagon will be there. Our next project will be for families at Washington. We did this last year. We're hoping to sponsor at least 10 families. And last year we gave them a food bag, and some of them had some outstanding bills for cell phone or insurance and stuff that they're carefully screened by the principal, and so we helped them out. So we're hoping to do at least 10 families this Christmas, and we'll start that project right around Thanksgiving time, because we want them to have the money so they can actually have Christmas, because a lot of them don't have any money for presents for the children. So that's our next project, and we'd love to have some members come join us.
If you've never volunteered at Washington School, you're really missing something. Seeing the energy in these kids is extremely moving, and it's a lot of fun. Did Sal Pizarro end up arriving? Well, on Thanksgiving, every year we have a program that Bob Keefe started decades ago, and his daughter Lenore is now doing that program. Lenore, you want to wave at everybody so they know who you are? See her in the back. If you're interested in participating, you can either go see Lenore after today's meeting or contact her anytime. It's absolutely one of the best meetings every single year, as it has been for 20 or 30 years. So if you're considering participating, please let Lenore know. It's just a beautiful program. So Leslie and I went to the Large Club Conference last week. The only reason I got to go is that Sal was awarded by History San Jose last week, and Sal should have gone as the president-elect, but since he had to get the award, you sent me, and I didn't get to go to any of those junkets because of COVID. So you guys owed me big time, a bunch of free beer and cheese curds and stuff like that. And what I'll say is that this conference really exceeded my expectations. Many of us, if you talk to former presidents, will say that district events oftentimes feel like a group of people who all aspire to do what we do on a daily basis, and that they have these conferences to come up with ideas. And there's this feeling that we've been there, done that, we're already are there. I know it's sort of a egocentric attitude, but it's real. And in Cincinnati, being with these 150 or so other executive directors, existing presidents and presidents-elect, it was very inspiring. We are not alone in our really high-quality work as a Rotary Club. Denver, Louisville, Seattle, and others are just doing fabulous work. And so I think Leslie would agree that we learned a lot, we're inspired a lot, and we have lots and lots of notes that we're going to compile soon. So Why am I talking about the Large Club Conference? Because we are hosting the Large Club Conference in 1 year, almost exactly a year from right now. Past presidents, Carl Salas and Cindy Faulkner, are chairing that. I don't know if they even have a committee yet. I should know, but I don't know. But any of you who want to help, let Carl and Cindy know that you want to help. The most striking thing about Cincinnati and this conference for me was the incredible generous spirit of these Cincinnati Rotarians. They picked us up at the airport. They took us everywhere we needed to go. They escorted us, et cetera, et cetera. They opened a bunch of very cool local places to us. And so Carl and Cindy are working on ideas that really manifest our hospitality. So I'd encourage all of you to please help. Call Carl or Cindy, or call me if you've got some great ideas that you think that we should do. And what I will point out is that all of the big clubs in the United States have exactly the same challenges and concerns that we do. And if I had to isolate or name a few things that really kept percolating to the top in all the discussions, number one was diversity, equity, and inclusion. Everybody is working on that. I think we all know the history of Rotary. It was only pretty much white guys in the old days, and then it was white guys and white women, and now we're expanding and welcoming everyone in the world. It's what gives us strength. There was actually a lot of diversity at the conference, which was very encouraging too. So number one would be diversity. Number two is membership. Everywhere service clubs are struggling. Rotary not as much as others. There was a statistic in one of the presentations, I think it was Lions or Kiwanis is down 70% in the last 10 years or something like that. So just know that we're not alone in struggling in membership, and Rotary's actually done better than the others. And then the third theme I would say is environmental stewardship and environmental challenges that as Rotarians, many of the clubs have really focused on taking this environmental crisis seriously and being part of the solution. So that's my summary. If any of you are interested in talking more about that, you can call me or come see me, certainly. And with that, I'll introduce my friend Suzanne St. John Crane to introduce today's speaker. Thank you.
Hey friends, how's it going? Good to see everybody. Woohoo! All right. I just had this brilliant idea, Steve. Why don't we all bring water bottles on Wednesday so we aren't using plastic water containers here? I mean, that's one thing we can do, right, in terms of green and climate. So anyway, that's my end of my public service announcement. Here we go. I am here to introduce Dr. Robbie Pearl, who is joining us by Zoom today. He's on the East Coast, and just delighted to have him here. For 18 years and up until 2017, Dr. Robert Pearl was the CEO of the Permanente Medical Group, the nation's largest medical group, and former president of the Mid-Atlantic Permanente Medical Group. In these roles, he led 10,000 physicians, 38,000 staff, and was responsible for the nationally recognized medical care of 5 million Kaiser Permanente members on the West and East coasts. Named one of modern healthcare's 50 most influential physician leaders, Pearl is an advocate for the power of integrated, prepaid, technologically advanced, and physician-led healthcare delivery. He serves as a clinical professor of plastic surgery at Stanford, is on the faculty of the Stanford Graduate School of Business, where he teaches courses on strategy and leadership. He's the author of Mistreated: Why We Think We're Getting Good Healthcare and Why We're Usually Wrong. That'll get your attention, right? A Washington Post bestseller that offers a roadmap for transforming American healthcare. All proceeds from the book go to Doctors Without Borders. And his latest book, Uncaring: How the Culture of Medicine Kills Doctors and Patients, shines a light on the unseen and often toxic culture of medicine. Side note, I interviewed Dr. Pearl for an ALF podcast. I want to say it was my second or third podcast 4 years ago, after having read his book, Mistreated, which deeply resonated with my experience of caring for a dying parent while I was in my 20s. And Dr. Pearl is a regular contributor to Forbes, has been featured on a variety of national broadcast and print media nationwide. So it's my pleasure to introduce ALF Senior Fellow and author, Dr. Robert Pearl.
Good afternoon, and thank you so much for that kind introduction, Suzanne. And congratulations to the Rotary Club for the great work that you do. In my clinical days, prior to becoming the CEO, I did quite a number of global trips to repair children with cleft lip and cleft palate, and quite a number of them were in partnership with the Rotary. So I know your work very well, and I applaud you for your commitment to helping to make the world better. I'll speak for about 25 minutes today and then take 10 to 15 minutes of your questions. And I want to focus on three issues, three things that have disturbed me probably for the past 5 to 8 years. The first one is, how is it possible that the United States could spend as much as we spend on healthcare with results that are actually quite problematic? We spend more on healthcare than any nation in the world, with the exception of China, Japan, and Germany, spends on everything, their entire GDP. We spend $11,000 per person for healthcare. Switzerland spends $9,000, Germany $7,000, and every other country spends less than half of the United States. And yet, according to the Commonwealth Fund, the United States is last amongst the 12 most industrialized nations in healthcare outcomes. Last in life expectancy, lowest in terms of care to children. Specifically, we have the highest childhood mortality, and we have the highest by far maternal mortality, despite the fact that, as I say, we spend more than any other country, more than India spends for all of the services to its 1.2 billion people, or as much as France spends, or more than France spends, on everything, including champagne and truffles. We spend a ton of money and we don't get great outcomes, despite what some patients might believe. The second question that I wanted to address is, why is healthcare the only industry? As Suzanne said, I teach at the Stanford Graduate School of Business. I look at a lot of industries. We're the only industry where over the past 2 decades, we've invested in computers, in data analytics, in artificial intelligence, in robotics, and costs have gone up without quality going up. Every other industry, quality has gone up and costs have gone down. Why is healthcare an exception? And then finally, the average physician earns over $300,000 a year and has the privilege every day of taking care of people in need. And yet, 44% of physicians are burned out, and there's over 400 physician suicides a year, more than one a day. So these are the questions that I've thought about for a while. And back in 2015, when I was still the CEO in Kaiser Permanente, I started to research it. Looked at the literature, traveled around the country, studied healthcare systems elsewhere. And what I came to realize at that time was that our healthcare system resembles a 19th century cottage industry. It's fragmented. Doctors work in their specialty, often alone in their offices, not connected to their colleagues, and patients can drop through the cracks as patients are handed off from one doctor to another. They're paid on a piecemeal basis. You know, we call it fee for service, but basically the more you do, the more you get paid, whether it adds any value or not, doesn't matter. Make a mistake, you're likely to get paid twice, once for the first procedure and then once for correcting your error. Doesn't happen in any other part of our economy that I can think about. And although we think about medicine as being technologically advanced, most of what doctors use is left over from the last century. Actually, that's not right. The most common way that doctors communicate with each other is through the fax machine, an 1834 invention, a 19th century technology. That is how doctors communicate one with another. And there really is not a leadership structure. By that I mean, as you'd seen in any business, any individual capable of making the decisions on capital allocation, redesigning operational delivery, evaluating the results and the people that provide the care. These are the questions that exist, all right, and the analysis that I did, and I wrote it up, as Suzanne said, in Mistreated. And as she said, the profits from both that book and my new book on caring, how the culture of medicine kills doctors and patients, all do go to Doctors Without Borders, a wonderful organization worthy of support. The challenge that I saw following my publication of the book, it was wildly successful, as I say, a Washington Post bestseller, but nothing really improved in the United States. In fact, it got worse. By December of 2019, the federal government released a report. It said that healthcare costs in the United States would go up 5 to 6% every year for the next decade. I did the math. You know, it's compound interest. Healthcare at that time was a $3.7 trillion industry. It's now over $4 trillion. So the healthcare would go up $2.5 trillion a year. It's a lot of money. I said to myself, you know, what if we use that same money to help patients with chronic disease, eat better, exercise? We help disadvantaged populations to get jobs that were more rewarding and able to keep them healthy, or whatever. We just invested in schools and preschools. I mean, how else might we use $2.5 trillion? And I waited for an organization to step forward and say, this is ridiculous. Let's spend this money differently, or at least let's make sure that we're going to get better health care as a result, but no one did. And it told me that something else was going on. So again, this was December 2019, about 4 months before the pandemic. You could still actually travel. And I went around the country again, talking to doctors and hospital CEOs and a variety of people. And what I discovered, it was this invisible force, this physician culture. It's like gravity, incredibly powerful, but you can't see it except by the impact it has on people. Culture is the values, the beliefs, the norms, ones that doctors learn in medical school and carry with them throughout their careers. They actually become inculcated on the first day, what's called the white coat ceremony. The students and the parents show up on campus. One by one, the matriculating individuals are called to the stage, where a faculty member drapes a white coat over their shoulders, with one exception. If a parent or both parents are physicians, then they have the privilege of draping the white coat. Now think about this. Why should the parents who are doctors be more proud of their children than the ones who are not? Maybe the other parents were immigrants, worked 2 jobs each, or farm workers toiling in the fields for 8 or 10 or 12 hours a day. Why wouldn't they be just as proud? What I realized is that this ceremony, this very powerful, moving ceremony, has nothing to do with the pride of the parents. This is the parents giving the university, the faculty, the ability to put their culture in place, similar to maybe the kings in medieval times, who when they married their daughters off would send a dowry, indicating that the groom's family could expect the bride to provide, to take on the culture of her new family. This is the ceremony that sits in place. And why can the parents who are physicians drape the white coat? Because they know the culture. They can be assumed to have taught their offspring the right set of values, beliefs, and norms. To really understand culture and the impact it can have, let me take you back to Austria, Vienna, Austria, 1850. Ignaz Semmelweis is selected to head the maternity service at the leading academic hospital across Europe. And he's appalled. The mortality amongst women giving birth there is 18%. He's embarrassed. There's a hospital adjacent, one run by midwives, not famous academic physicians, and their mortality is 2/3 lower. At the time, the leading cause of death was puerperal fever, an infection of the uterus that goes on to spread throughout the body. The etiology was said to be these smelly particles called miasmas that would drift up from the streets below. But Semmelweis says this makes no sense. Why should our patients in labor, they breathe hard, but so do the ones in the adjacent facility. Why should our patients all be dying from this and their patients far less? Now, in medicine, we often make advances through serendipity. And one day a colleague of Semmelweis's nicks his finger while doing an autopsy on a woman who's just died from puerperal fever. And lo and behold, he gets a local infection that spreads through his body, a clinical course almost identical to these women who died following childbirth. And Semmelweis says that from now on, if a physician is going from the autopsy area to the delivery area, he, and they were all men at the time, would have to change the leather aprons they wore to protect their well-pressed three-piece suits, ones that were often covered in blood and pus, and they'd have to dip their hands in chlorinated water. Within a month, mortality drops to 2%, 90% reduction. Semmelweis writes it up in the leading journals, writes letters to the maternity service directors across Europe, and guess what happens? Nothing. Nothing changes. He's ultimately, I mean like next year, fired, admitted to a mental institution where he dies 4 years later. Now I want you to think about, when we talk about advances in science not happening, what do we say the cause is almost always? Money or time? There's no money involved. Putting on a clean apron, dipping your hands in water, there's almost no time involved. So how do we explain it? It's this invisible force of culture. You see, doctors think of themselves as being healers. The idea that they are not healers, they're carriers of disease, it's just not acceptable. It lowers their status. Culture is about status and hierarchy, and it lowers that status. And those leather aprons, the ones that protected their suits, they were signs of experience. The more blood, the more pus, the more guts, the better doctor you were. The last thing you would ever do culturally is want to put on a clean apron. It would be 50 more years before Louis Pasteur comes along that doctors would do this. And today, the leading cause of death in American hospitals, hospital-acquired infection. The bacterium is called C. difficile, Clostridium difficile. Every doctor knows it doesn't go through the air like the coronavirus. It's carried on the hands of people. What would you say if I told you that in dozens of studies in leading hospitals across the country, 1 in 3 times, physicians go from one patient's room to the next and fail to wash their hands? Now, we have what's called alcohol-based disinfectants. It's at the door of every hospital room in America today. It costs nothing. It takes no time. And yet doctors don't do it. You see the same thing when it comes to technology. Let's go back again into history. Hermann Boerhaave meets a gentleman named Daniel Fahrenheit. Fahrenheit just invented this incredible device that can measure temperature down to 1/10 of a degree accurately. Boerhaave looks at it, he says, wow, this is amazing. We can differentiate healthy from unhealthy people. We can figure out when people are sick. He tells all his colleagues about it. And rather than embracing this thing called the thermometer, they reject it. Because at the time, the value in the physician was embedded in their ability to lay their hands on the patient and measure temperature. The fact that it was not exact, certainly not down to 1/10 of a degree, not reproducible, that didn't matter. In a cultural environment, it's not logical. It's about esteem and status. And it's why, until the coronavirus came ashore, doctors didn't use telemedicine. 7 years ago, I read an article for the leading journal called Health Affairs. about at the time when Kaiser Permanente were doing 12 million virtual visits a year. And no one adopted it. Fewer than 1% of visits in America were being done virtually. And then all of a sudden, when the coronavirus comes to shore, it soars to 60, 70%. The technology didn't change. It's the culture, this invisible force that sits there. But before I talk a little bit more about the downsides, I want to emphasize my book and my opinion is not that it is bad culture. Sometimes it's great, and the coronavirus was a terrific example. Those trips around the globe taking care of kids with cleft lip and cleft palate is another example of that physician culture. You know, in the coronavirus early on, doctors didn't have the protective gear they needed. They often donned garbage bags when there were no gowns and salad lids when there were no masks. They came in and took care of patients 8, 12, 24 hours at a time. They knew that every time a patient couldn't breathe, they passed the tube through the mouth into the lungs. As it went through the vocal cords, the patient would cough, spewing virus in the face, and they did it anyway. You see, it's that culture that allows doctors to deny the risk, deny the fear, and to provide that care. It's a beautiful culture when done well. But I wrote the book to point out the times when it doesn't necessarily happen as well. And I'll give you a couple of examples today. You can certainly buy the book and read it. You can also go to my website, robertpearlmd.com, where I have some more information about it. But one example is with chronic disease. Chronic disease is a leading cause of death in the United States. These are diseases like diabetes, hypertension, chronic heart disease. These are ones that you have your whole life, asthma, and they flare up and create problems that exist. They account for a significant part of the American healthcare costs, a growing percentage of deaths that sit in play. And we don't do a very good job across the United States of taking care of it. As an example, when I was the CEO in Kaiser Permanente, we controlled hypertension, which is, by the way, is the leading cause of strokes and a major contributor to heart disease and kidney failure 90% of the time. Across the US today, it's 55% of the time. And why is that? Because doctors just don't value it. They don't see it as being that hard to do. Anything that someone else, a nurse can do, a physician's assistant can do, lowers that status. And as doctors, we just don't pay as much attention. We elevate the individual part, or at least we diminish it, even though the data says that adding 10 primary care physicians to a community increased longevity 2.5 times more than adding 10 specialists. Another example, the Mayo Clinic looked at all the care provided across the United States, and they showed that 30% of what doctors do today, the testing and the procedures, add no value. And we keep doing it. There are procedures where they've done sham studies. They make the incision, but they don't actually do the procedure, and the results a year later are no different than when the procedure is done, and yet doctors continue to do it because in the culture of medicine, we tolerate individual variation, anecdotal experience. We look aside when care that's provided is not going to be of any great value to the patient. That's the culture we learned and the one we carry with us. What we know is that medical costs are a leading reason why people have to declare bankruptcy, and yet 1 in 5 patients who go to an ED or 1 in 5 patients going to an OR receive a surprise bill. The bill reflects the fact that doctors and insurance companies are battling, and like the civilians that are placed in war areas, in areas of potential harm, bills are sent to patients, creating tremendous problems for them. And in the culture of medicine, we accept that that's an appropriate action to take. It's the norm that our colleagues do, but I can't come up with a good justification for it. And it's the other side of the very positive way, as I pointed out, that the culture leads doctors to be heroes in times of pandemic and globally in terms of volunteer type work. And it also creates the burnout It creates the sense of lack of importance, of lower esteem. What we see is that certain specialties, the ones that don't do the interventions, like primary care, are at the bottom of the totem pole. And what we see is that they find themselves with symptoms of lack of fulfillment, satisfaction, and fatigue. They are ones that Sir Michael Marmot, a sociologist in England, has shown come when your status falls. And it's a major cause of burnout today and a contributor to physician burnout. I think in the post-coronavirus era, this is all going to come to a head. And I say that because we will have borrowed $8 trillion at the federal level that we'll have to repay. We'll have the states by law have to have a balanced budget, and they'll have higher costs for unemployment and higher costs for Medicaid. And particularly small businesses, and many of you are small business individuals, you've burned through all your savings and you just don't know how much longer you can hang on. And I like coming to organizations like this because I actually believe that there's a high probability that if change is going to happen, it's going to happen through the businesses of America. I mean, you're the ones who employ 155 million Americans. And it's particularly, the large businesses have a lot of employees, but there aren't a whole lot of them. The majority of the 155 come out of a variety of small businesses, medium-sized businesses, retail businesses, various organizations. And I think that business leaders will say now is the time that we have to bring down their costs. And I'm optimistic that if the business leaders say we need care that is going to be capitated, by which I mean you're paying a set premium at the delivery system level, not the insurance level, to provide care to a population of patients with results being measured. And you expect that doctors will be integrated into groups. They'll be able to provide care seamlessly with handoffs that are easy to accomplish and convenient for patients, and embrace new technology, creating far better tools than the electronic health records of today and the fax machines of yesteryear, and are willing to have a leadership structure that we can do better. The second way that change could happen is that it actually could come out of the medical system itself. We see that in some what's called primary care groups. Many of them are in person and some of them are virtual, that are able to work together, creating what's called medical homes on behalf of patients and taking out some of the waste. A great example of the waste is if you call your doctor's office at 5 o'clock or 6 o'clock tonight, what are you likely to get told? Go to the emergency room. Now, if you're having a heart attack or stroke, that's exactly where you should go. If you're having the kind of problem that could have been taken care of in the office today, it's the last place you want to go. They don't have the information about you. They'll never see you again. They'll do a lot of testing to see whether you have a terrible disease. What you need to be able to do is to be able to speak to someone who has your record, has your information. And if they can do that, they can eliminate a lot of the unnecessary visit. And at the same time, if you are having that emergency, ensure that the information is transmitted to the ER and the care that's provided is immediate and of the intensity that's needed. And the third way it could come is from another organization. We saw that with Haven, that brought together Amazon, Berkshire Hathaway, and JP Morgan Chase, an organization that has the potential to be able to provide care. And as I said, when the organization first formed and Jeff Bezos talked about how this would be only for their employees and as a not-for-profit, I said, anyone who believes him probably thinks that Amazon only sells books. Now, this is going to be a major retail venture on their part. And which of the three it's going to be, I don't know. But I do know that doctors will have difficulty with the transition. Kubler-Ross has described the 5 stages of grief. And you see it already. Some are in denial. Some physicians are just angry at what's happening. They call it burnout. They call it moral injury. Some physicians have started bargaining, taking jobs with hospitals and insurers. Some are depressed. But I think acceptance, the 5th stage, is the one that will need to be, which is that the world has now changed. We can't provide care with the same approaches of the 20th century and now almost the first quarter of the 21st century. And I'm hopeful that similar to when Roger Bannister broke the 4-minute mile. Before he broke it, it was said to be impossible. And once he did, 10 people also broke it within 2.5 years. I think other groups will move along, but it's going to take the push of people like yourselves, business owners, who are community leaders, who are saying there is a better way. The time has come to demand it. And when you start demanding it, I think the system will be able to respond. When I was writing Mistreated, I went to Oregon. I went to the Health Sciences Institute there. When I walked through the door, there was a sign. It said quality, service, and cost at the top. And below it, it said, pick any two. In the 21st century, we don't have to pick any two. I believe that we can have higher quality. I believe that we can have more convenient and easier access. And I believe we can do it in a way that leads to lower care. And in the process, I believe that we can advance not just the system of medicine, but the culture of medicine. And once again, make America the best medical care place to receive that care anywhere around the globe. I welcome your questions. Thank you.
Robbie, thank you so much. That was fantastic. I'm just glued to your words and your perspective. Really appreciate it. We have a couple questions on Zoom and certainly a line forming here in the Summit Center with questions. So, Judge, you want to kick it off here?
Yes. What a wonderful presentation. Thank you very much.
Thank you.
Do you think, in general, patients get better health care at large organizations like Kaiser than they do with individual practitioners? And as a different question, do you think there are more suicides among the lower prestige doctors than among the higher prestige doctors?
So the first question, I think, is really based upon your disease status. And I don't think it's a question of the institutional size per se, but the coordination of the care. So if you have a single problem that needs to be fixed, it's going to be a reflection of the excellence of the physician. But if you have multiple problems or chronic problems, now it's going to be based upon that ability to provide integrated, continuous care. And in most communities, that doesn't happen. You know, I write in Uncaring about when my mom died. I dedicated the book to her. My first one dedicated to my dad, who died of a medical error. The second one to my mom. And I remember she had a very complex medical problem that she ultimately died from. She had 7 different specialists, and they never talked to each other ever. Each came by every day. They wrote notes in the chart, but the opportunity for a major medical error was just really significant. You know, I heard a statistic that says that for every 200 patients admitted to the hospital, 1 will have a medical error. And your chances of getting killed by a medical error in a US hospital today is far greater than skydiving. And that was a pretty scary statistic to me. And I think that happens less in large integrated ones, particularly if they share a common electronic health record. That, I think, is a key characteristic. And if your doctors all have separate records and they all have attempts to keep your allergies and your medication straight and all of your testing right, the likelihood of you having a problem, unless you manage it all yourself, is just too great. In terms of the suicide rate, again, I only briefly touched on the burnout issue. It's less about the low and high status than the change in status. And I think that, again, based on the work that Marmot did, if people lose status, that's when they start getting depression. That's when they start having more suicidal thoughts. And that can happen in various specialties. I write in the book both about urology, which has the highest burnout rate, for a reason that's maybe unexpected. You know, what gives doctors a lot of status is doing fancy Star Wars type things. And for urology, it's the robotic prostatectomy. You know, it's the video game equivalent in medicine. It's the top of the art. And they used to do a lot of them. And then in 2010, the National Preventive Services Task Force said that the PSA, which was the test that men had after the age of 50, that was able to identify who might have a high risk of a prostate cancer, was found to be not helpful in terms of extending life expectancy. And then the next thing that happened was that the data showed that watchful waiting rather than surgical intervention was just as good. And then people started to discover that centers of excellence that did a lot of these were less likely to leave the patient with the complications of incontinence and impotence. And it started to disappear from the armamentarium. And urology, that had one of the lowest burnout rates, now had a high burnout rate because their status dropped significantly, despite the fact, by the way, that they make almost $500,000 a year, and despite the fact that they have to use the same computer systems and go through the same bureaucratic tasks as other surgical specialties like orthopedics or ophthalmology, whose burnout rates are basically half of what they are in urology.
We only have time for a couple more questions, but I want to just get to one real quick one, and then we'll go to Councilmember Cohen. One online here is, what advice would you give us in terms of personal advocacy and responsibility? This comes from your ALF classmate, Linda Gold.
Hi, Linda. Good to have your question. So in the book, I have an entire chapter on what's called the 9 questions or 9 sets of questions that every patient should ask. And given the time, I only mentioned 3 of them. So I think that if you have an acute problem and you're seeing the physician, the right set of questions is, do I have to come back to the office, or can you do the follow-up through video? Can I email you? Can I text you? I mean, these are modern technologies. Why shouldn't I be able to use them in my healthcare? I use them in every other part of my life. What should be so different about that? And if you can't do that, maybe you saw the wrong doctor in the first place.
And for her daughter-in-law that was diagnosed with a disease, she's at U of M and Mayo Clinic. I think that's specifically what she's talking about, Robbie.
Yeah. I think the second set of questions that you need to ask if you're going to have a procedure done is, how many of these did you do last year? And how many of them would you require a physician to have done to allow him or her to operate on you? And finding out who has done more of them, what you'll discover is that the average patient is taken care of by a doctor who doesn't do enough procedures in any given year to be really good at it. And finally, I throw out the idea that if you have a serious problem, advanced cancer that you've already had chemotherapy for, maybe heart disease, which you've had various admissions to the hospital and keep getting worse. You want to know about end-of-life options. You want to know about alternatives, hospice and alternatives to hospice. And maybe the most important question to ask your doctor is, if at some point I decide I don't want to have any more medical care, will you still be there for me? Or will you desert me at that time? So the book has an entire chapter of questions, and feel free to ask them to your doctors. You're the patient, you deserve it.
One more quick question, potentially?
That was this on?
Yes.
Yeah, I'll make it quick. Can you just give your thoughts about how our reliance on the for-profit insurance industry perpetuates some of these things that you've been talking about?
Yeah, I would say that it's our reliance on the insurance industry, because if you actually look at the not-for-profits and the for-profits, and by that I don't mean the safety net programs, but there's not very much difference between for-profits and not-for-profits, because in medicine today, it's all about how do you gain control by consolidation. Right now I'm sitting basically at Yale, because that's what I'm doing on the East Coast right now. And Yale owns every hospital, 17 hospitals for 50 miles. You can't get medical care unless you have Yale. And you can be sure that they're going to drive up costs, and yet they're not for profit. And there are other ones that are doing the same thing that are for profits. I think it's much more a problem inside the care delivery system, that rather than being able to figure out how do we provide higher quality, easier access, greater convenience, more personalization at a lower cost, we simply are asking, how do we get more control of the marketplace to raise prices, and in the process of doing that, to be able to either generate profit for their shareholders or to generate new buildings for the not-for-profit world that's there. The American healthcare system is broken, but so is the culture of medicine. The world has changed. The time has come for America to change. The culture of medicine is amazing. mRNA vaccines created by Americans has revolutionized the pandemic. It should have brought an end to it, but politics got in the way. We are innovators. We are scientists. We are dedicated individuals functioning in a broken system. The time has come for change, and I'm looking to you folks to help to demand it and to make it happen and to once again make American medicine the best in the world. Thank you for inviting me today. Thank you, Suzanne.
Thanks a million, Dr. Robbie Pearl. Appreciate you being here, friend.
Thank you, Dr. Pearl. First-rate program, I'm sure you all agree. A contribution will be made on your behalf to JW House, which is a wonderful place next to Kaiser Hospital in Santa Clara, run by our Red Badger, Rich Angeloni. Rich, you there? Somewhere? You just left. Well, thank you, Dr. Pearl. Next week will be Katrina Stevens speaking about the Tech Museum. Meeting adjourned. Thank you all.